Hi, my name is Gilbert Morgan. I am a physician from Texas working in medical oncology in Sweden. I am also the director of the Oncolert Network, and it's a great pleasure to be presenting today on this very special year in review on how COVID-19 has transformed clinical care. Our presentation today is the impact of social media on cancer education, the Oncolert innovation. However, I plan to go one step further. I want to give you the secret sauce, the reason why Oncolert has been successful during these past 18 months, and how Oncolert represents the worldwide oncology community, from India to Egypt, Sweden to the US. We're all part of the Oncolert family. So first, let me give you a breakdown of what I will be talking about. As I said, number one will be the network. So in this is how your network actually defines you. And I will give you an introduction of exactly who is Oncolert and why Oncolert is a good definition of how you can build a network when it comes down to a network of colleagues. Number two is the power of education, and that is how we can educate through social media, both oncologists and not only oncologists, our oncology nurses, our doctors, anybody in cancer care, along with our great colleagues that are patient advocates. Number three is the importance of smart collaborations, because it's good to have collaborations. They make things a lot easier, but you don't just collaborate with anybody that wants to collaborate with you. You have to be smart about it, and you have to pick the right collaborator that is going to complement the strengths that you already have. And we'll end up with not getting lost and actually prioritizing your work so that you work smarter and that you keep your focus on what's important. This is definitely something that can take a lot of your time. Besides being incredibly addictive, it's something that requires a lot of effort and in a lot of hours. So you have to, for all of us that work 100% clinically, or are doctors, or have another job, we need to be smart about how we use social media and how we can actually engage in a smarter way. So the current advances in technology have allowed us to shape society in a completely different way, affecting the way everyone communicates and thinks. They influence the way that we learn and educate, both ourselves and our colleagues. And this is definitely the case in medical education, where it facilitates knowledge, improves decision-making, and helps in practicing for rare critical events. However, on top of this, technology is helping in dealing with geographic inequities in medical education worldwide. The use of cell phones, platforms like Facebook, Instagram, YouTube, Twitter, they have allowed us to have a free discussion, and it's completely out in the open, with input coming from every possible direction. Health professionals have begun using social media to benefit patients and enhance professional networks. Platforms like WhatsApp, Messenger, and others allow for what we call dark social media, where groups can participate and feel free to discuss a variety of topics in private, thus improving collegial communication, enhancing professional development, and contributing to public health research worldwide. Now, this is called dark media not because there's a negative connotation to it, but because it's something that happens in the back channels, whereas the light media is everything that you can see on your Facebooks, your Twitter. So these tools not only allow us to have an open conversation with a worldwide network, but they also allow us to have it across different time zones and in real time, with a facility never before seen, and more often than not, with very low cost, creating a perfect opportunity and environment for education. Social media has changed the way that we share developments in our field, with recent studies showing that articles that are shared on social media are often cited a lot more than those not amplified by social media, thus providing a large incentive for researchers and clinician researchers to have a good presence on social media to drive your research further. In the same way, we can use social media to reach captive audiences that have specific needs. This is a perfect way to find those most in need and able to reach them, even if they are in the remote corners of the globe. When applied to the medical field, social media has a remarkable potential to help both educators and doctors, where physicians enhance their teaching learning experiences with great opportunities for networking and collaboration. Social media is starting to change how we practice medicine. It gives us the opportunity to engage us in public and health policy discussions, allowing the formation of professional networks and making it easier for patients to get the medical information they need in order to stay up to date. OncoAlert is a network of cancer care research professionals and patient advocates who have come together to fight cancer online and offline through social media and personal collaborations. We've been around for roughly around 18 months and have a presence on Twitter, Facebook, LinkedIn, and Instagram. However, that is a very vague description of the network. What it has done, why it has developed, and why it continues to grow is a completely different thing. They always say that you should save the best for last. However, I will do something a little different here. I will give you the secret to the success of OncoAlert just at once. And that is our flexibility and adaptability to meet the needs of our colleagues. It's being colleagues ourselves and understanding what colleagues need, because we practice alongside them and communicate and interact with them on a daily basis. Most OncoAlert initiatives have formed this way as a response to the needs of our colleagues. A year and a half ago, a much smaller group was brought together to start an oncology network with the goal of amplifying oncology information and to potentially be a reliable source for colleagues when it comes down to the latest in oncology and simplify the delivery of what we deem to be important information and get it into the hands of our colleagues worldwide. With every month, new possible members were spotted and followed, and eventually were asked to form part of the network. This is the formula that OncoAlert still follows to this day. The network has now grown over 140 members, each one of us working in different tumor groups in medical, surgical, and radiation oncology. We have oncology nurses, scientists, and of course, our patient advocates. Our patient advocates are our biggest colleagues. We believe in a flat structure, and we believe that the conversation that needs to be had among people that care or people within cancer care should be flat. We all have something to say, but we all should be sitting in the same table when that discussion is being had. In ASCO 2019, a paper came out which highlighted that the engagement of oncologists at the meeting was increasing. However, the patient advocacy engagement dropped substantially. As a response to this, the OncoAlert Network decided that we would use our growing influence and reputation among our colleagues to amplify the needs and the voice of our patient advocates. On top of this, we also decided that 10% of our network will always be patient advocates. So we adapted our goals and expanded our base. And this is something that we have done continuously. Although when we started our network, we aimed to spread education within our oncology colleagues, it didn't take long to see that the power of social media in advocacy had a lot of potential, and how this education that we were providing, it was something that it should not just be done for oncologists or for other people working within cancer care, but also it should be placed in the hands of advocates. We saw that social media in itself is a great tool for our patient advocates. It can provide a large platform for networking and collaborating with advocates around the globe. It does not require money for the most part. It allows for easy communication with doctors, nurses, scientists, and other advocates in order to engage, advocate, learn, and teach. It is a great way to raise awareness, especially when wanting to make changes in policy or in government. It gets all issues out in the open. And finally, it allows for easy contact and access with media and news outlets, which facilitates exposures and gives more attention to what is being advocated. Alongside with patient advocates, OncoAlert has played a role in education. During the San Antonio Breast Cancer Symposium in 2019, we teamed up with Grasp Tweets, led by Julia Mouse and Christine Logdon. This is a 100% patient advocate initiative where expert patient advocates would lead a poster walkthrough, and oncologists also participated in this. During this first Grasp poster walkthrough, we were 13 OncoAlert colleagues that formed part of this initiative. We aimed at amplifying the impact of this initiative within social media, but the result was different because what we saw was a great interaction between scientists, patients, and doctors, where we could actually research or go through everything that we were examining through the posters, but we all had different points of view and we all had different perspectives. And it actually gave our oncologists the ability to see things through the eyes of the patient. So through social media, we have also had different presentations aimed at teaching advocates the power of social media and how to embrace it. We would teach how to harness that power and how to amplify their message. And this is something that we have done both in real life, when there was a time when we had real life in the beginning of this year, and of course now on social media, because we have figured out that this is definitely the way to go when you want to reach our advocates worldwide. When it comes to oncology education, this was something that was personal with me, as it has been a priority for me for the past 4 years. Coming from countries like Sweden and the US, the education that is delivered is actually organized, updated, and with plenty of financial backing. In speaking with colleagues from many countries, we realized that there are many oncologists or doctors caring for cancer patients from different countries that were requiring help. And we know the world is not fair, and although we live in the same planet, there are large inequities, and social media education can aid in addressing these. There are many questions in developing countries when it comes down to the quality of higher education. However, most people in developing countries own a smartphone or they have access to the internet. Regarding social media, people in developing countries are catching up. So the narrowing of the digital divide is coming. So that difference between wealthy and developing countries when it comes down to digital media is becoming smaller. Social media and its use has the ability to improve the delivery of education, improve the sharing of new research in real time, and the expansion of international networks for research. Through the use of our social media networks and partnerships, we have been able to form symbiotic relationships in where we can provide high quality education based on guidelines from international and national societies and from a well-respected faculty. This all started a while ago, as I said, maybe about 3 years ago. Even myself, before there was an OncoAlert, I was lucky enough to team up with the European School of Oncology, and together we would come up with different lectures, of course, all based on guidelines. So basically all we were doing is giving me information regarding the guidelines. This was nothing that was super advanced, and it was on something that I believed really needed to be tackled. Like, for example, on this one, it was the management of end-of-life symptoms and palliation in cancer, which is something that I think every doctor can be better at. They say if you want to go far, you go together. Through the use of our social media networks and partnerships, we have been able to form these symbiotic relationships. The OncoAlert network has partnerships with the European School of Oncology, the Multinational Association of Supportive Care in Cancer, or MASC, the International Society of Geriatric Oncology, eCancer, and VJ Oncology. We have previously had and have ongoing collaborations with Institut Jules Bordet and the European Society for Medical Oncology. However, partnerships are not worth it if they are not fruitful. So we have teamed up with our partners in order to spread education. In December 14 to the 18th of this year, OncoAlert has started what we call the OncoAlert Colloquium. So the OncoAlert network, alongside with MASC, CEOG, eCancer, and VJ Oncology, will host a colloquium during this week. We will have 3 daily hours of streaming. This will be divided by tumor group, presenting the latest of 2020. So everything that has happened on 2020 on every tumor group, all the latest findings will be presenting in these blocks. These will be presented by our OncoAlert faculty and also alongside with great faculty from MASC and CEOG. One of the big things about education is the price, convenience, and accessibility. That is a reason that we have made the streams at a time that it is most comfortable for almost every time zone, where it's lunch in the US, after work in Europe, and late evening in most places in Asia. The price has to be free, so that all colleagues, no matter the geographic area or the financial situation, have a chance to get an updated review from world-class faculty. The great thing about our network is that we are all working professionals, and all we do is because we believe in what we are doing. The faculty has gladly given their time in order to further educate our colleagues. As mentioned earlier, the developing countries are narrowing in the digital gap, and now most have access to internet and often smartphones. So by streaming our colloquium in YouTube Live, we make sure that this is accessible to almost everyone. Although we are focusing on the education of our colleagues, the OncoAlert network believes that we have no better colleague than our patient and patient advocates. So not only is it important for us to listen to what they have to say, but it's also our duty to help them in getting updated and help them to get their education when it comes down to cancer and oncology. Here is even a stronger reason that these kind of meetings should always be free. So what can we learn from the OncoAlert experience? The power of the network extends more than your own personal gain. Yes, of course, we try to promote things that the network does. And of course, we have the newsletter, the podcast, the roundups. But at the same time, the roundups are something that we do with our partners from eCancer, and our OncoAlert Instagram head editor is Petra Bukovic from Croatia, and she's doing an amazing job. Now, what you have to do is you have to go ahead and lift up the people that are doing all this work and make sure that you're giving them plenty of credit, because they do these things for not only for free, but they do it with a lot of passion. So you have to make sure that you're highlighting all the great work that they're doing. For example, Matteo Lambertini did a great video for the European School of Oncology alongside with OncoAlert. We had some great sessions with VJ Oncology for our oncology nurses with Darcy and Helena. And of course, recently we've had, actually a few days ago, we've had the Kidney Cancer Research Summit, in which two of our great OncoAlert faculty were actually co-chairs, and it had a wonderful keynote speaker, a Nobel laureate keynote speaker. So you kind of amplify this message, and you use that to go ahead and promote great people in social media. So it's not just promoting in yourself. Another thing was the OncoAlert Rising Stars, and this is a program that we came up with in order to highlight our young rising talent that is doing an amazing job when it comes down to research. And we wanted to make sure that they were getting the recognition that they deserved. So far we've had three, two coming from the US, Akash Desai coming from the Mayo Clinic, Sia Bakuni coming from Dana-Farber, and Katrin Heinrich from the University of Munich. All three are doing amazing work, and we are coming up with, actually the videos are already out, and you can see their research being highlighted. So it's important. It's important that we grow. It's important that the success is shared, and that people see that that focus that you're promoting, it's not just about yourself, that you're using that power, or I don't even want to say power, but that influence that you're building up in order to promote others. Once they see that you're not just promoting yourself, I mean, of course, we're on social media, you have to have a little bit of self-promotion, but the majority of it has got to be promoting others. And that's how you develop a strong network, which I believe has been the reason why Oncolert has been so successful. So that is the power of working in a flat structure. We're all in the same team, from doctors to nurses, patient advocates, scientists, everyone in cancer care. We all have the same goal, but we do our jobs a little differently. Would it not make sense that it's better to have a discussion out in the open in the same table? So as doctors, our work is not more important, it's just different. If we figure out a way to work effectively, we can maximize the way that we benefit our patients if we just have that discussion in that same table. This is a great way of having the power of communication at your fingertips. There are many colleagues out there that don't have optimal oncology education. It is the duty and the privilege of those in better situations to help. Social tools facilitate this so that anyone can do it. However, we have the moral and ethical responsibility to provide quality products, free, easy to deliver, and readily accessible. Now, do not reinvent the wheel. Great ideas are not enough. No one man or no one woman is an island. Think about what you want to do, figure out how you want to get it, and figure out how you can get others to chip in. And this is what we were talking about, where we were talking about finding the right partner. A partner that will complement your strengths, make up for your weakness, and be able to partake in these discussions. Don't take partners that do the same thing as you. Everyone has to have something to bring to the table. The final point I would like to make is that you have to have fun. And most importantly, do not neglect your family. It is very important for social media to take over your habits. All of a sudden, you will be checking your phone every 5 minutes. And you must remember that this is a tool that you control to help you be a better version of yourself, not a tool that controls you. So even though this is a noble tool with the potential to help you develop, it is also an addictive one. So you have to have ground rules before you start. So keep your purpose paramount to the existence in social media. Everything you do, it should be there to help you achieve your goal. If it doesn't, you have to regroup, refocus, and get back to your main goal. So my take-home messages: number one, to make a difference in social media education, you have to provide a service. You can't expect everyone to hop on board just because you came out with a product. That product has to serve a specific audience. It has to be a quality product delivered by a quality faculty. And at the same time, you're going to have to work on the delivery, because you can't just put it out there. You have to make sure that when that is delivered, it's reaching everyone you want to reach. And most of all, that those people share it forward. Two, social media has the ability to help those most in need, colleagues with less resources and patient advocates. You just need to deliver it. So make sure that when you're creating the content, that you're thinking about your audience and what they need, not what you want them to hear. Number three, the biggest impact comes when you work smart and synergize with partners. Having the right partner can make a big difference. We have learned this as we have grown, and every partner has been specifically picked for a reason. And they have teamed up with OncoAlert, I imagine, for the same reasons. We can provide something for each other, but what we're doing for each other is actually being done for the sake of our colleagues, because we want oncology to continue to develop, and we want oncology information to continue to spread. Number 4, and the final point, is social media is a tool that you control. Do not let social media be something that is taken away from the important part of life. From your patients to your family, remember that this is something that you can control in the schedule that you make. So with that being said, I would like to thank you. I thank the organizers for the kind invitation, and I look forward to engaging with everybody out on social media. Thank you.